Hi, I'm Melanie from UWorld. We're looking at Next Gen practice questions from the UWorld question banks. Now we have an overview of the highlight NGN question type. So looking here at this item, we can see that it looks pretty different from a traditional item that you're used to seeing that has buttons to click. So here, what's interesting about the highlight items, you have to do a little bit of investigating to find what you actually can select as an answer option. So starting off here, we can kind of wiggle around. You have to use your cursor on these items, and it'll tell you here, click to highlight the foods here. Well, this particular item is about foods. It's not really an NCLEX item. We're going to look at a more clinically realistic item in a little bit here. But let's just look at the item mechanics first. So for here, we're going to kind of move our cursor around and then go over the text. And you'll notice that when the cursor hovers over this section of text, you get this pale yellow highlight that pops up. This is to let you know that this is something you can click on. So you don't actually just highlight it, you hover to find the things that you can click on. And then when you do click on them, they turn this darker yellow. And when they turn this darker yellow, they're going to remain highlighted as you move your cursor away. So then you know that you've selected that answer option. So let's unclick it and kind of go through here a little bit and see if we can find the other answer options. So we'll just kind of hover our cursor and move it along the text here. And we hit this word. So this is an option that we could click. And we'll kind of move down here to the next row. And then here, peanut butter sandwich is something that we could click. So far we have pretty much two foods, the spaghetti, the peanut butter sandwich, and that word cafeteria was an option. And then we'll kind of come back down here, and then we can see that chocolate pudding is also something that we could click on. And I think we'll go ahead, and you know what, that one, that's a food. We're going to click on it. That's one of our answer options. And we'll kind of continue scrolling through and see if we can find any more. Oh, and it looks like also afternoon is something that we could click on. So we kind of have an idea now of what we could select for our answer options. So let's go back to the top. Now here we're asked to highlight the foods. So starting from the beginning, spaghetti, I would definitely say that's a food. So we'll click on that one. We'll scroll through again. We know that cafeteria is an option. They serve food in the cafeteria, so maybe. And then we'll kind of go down to the next row, and our last option we were thinking about was peanut butter sandwich. That one's a food, so we'll click on that one. So those are our answer options, and it doesn't limit you. You could keep going, and you can select all the options if you want to, because it doesn't say a specific number. So let's go forward and click and see about scoring for this item. The little pluses and minuses here give you an idea of where you're getting points. So this one, just like the other types of NGN item types, is going to be partial credit scoring, which is really exciting for us because it gives us more chance to get points. So here we can see that we were correct. Spaghetti is a type of food. You get a +1. Same for peanut butter sandwich and chocolate pudding. We get 3 points there out of 3 possible points. Those were the 3 options to pick. Unfortunately, we did also select one option that was not a correct response. And so we're going to have 1 point subtracted here because this one is a plus-minus scoring model. So that just means that, you could have selected all the answers. So there has to be some sort of repercussion for selecting incorrect responses. So we've got the 3 correct responses and we selected 1 incorrect. So it's 3 correct minus 1, you get 2 out of 3 points. Now that doesn't mean that you could have gotten 3 points for the question. That just means that out of the possible credit for this question, you got 2/3 of it. So that kind of helps you get an idea of how the partial credit scoring works for this highlight item. Now we're going to switch over and we're going to look at an actual NGN-style item with a clinical scenario attached to it from the UWorld QBank. So let me pull that one up. All right, so here is our actual UWorld question bank practice item. So this is that more clinically realistic item for what you might actually see on the Next Gen NCLEX when you get there. So if you see here, it's a split screen, like all of the case study items. Over here on the left, you've got your scenario. And this particular item, being a highlight item, is actually going to show you the same scenario twice, because what they've asked you to do is to click to highlight findings within that scenario. So starting off over here, we can see this is a 20-year-old female client. And we can kind of read through, I'm not going to read through the whole thing, but the basics of it, she's having some emesis and abdominal pain here, polyuria, polydipsia, an unknown last menstrual period, no medications. She's drowsy and only oriented to person at times. So that's concerning. And then vital signs are off here. And we've got pretty elevated blood sugar. So Let's look over here, same note here. We're going to start going through and hovering to see what we can highlight on. So here also to note, it tells you, unlike the other item we looked at, this one tells you you're going to find 6 findings. So we got to keep that in mind as we go through. So let's start hovering through the note. The parent brought the client to the hospital. Okay, so here's one option, sore throat and nasal congestion. That one's interesting because sometimes when you have like a cold, it can actually precipitate. What I think is going on is DKA for this patient, and that can actually be precipitated by an illness. So that's something that might be concerning. Let's see what else we have here. We'll go through and see what we can click on. Pregnancy status is unknown. That's definitely something we want to follow up on. Remember, it's asking us, what do you need to follow up on right now, immediately? Definitely we need to know now. Is she pregnant? Because that abdominal pain could be, a women's health issue. Scroll through, see what else we've got. Definitely the orientation here is an issue. She's drowsy. She's not her normal mental status. So we definitely want to follow up on that immediately. Abdominal findings. Okay, so we get abdomen is soft, but no guarding and no rigidity, which is great. Normal bowel sounds. Probably don't need to follow up on that right this second. No blood and emesis. Respirations are rapid and deep. All right, vital signs. We definitely think these are a little off here. Pulse is too high, so we're definitely going to follow up on that one. Respirations are too high. And then her blood pressure is on the low end, which is not normal. And then, of course, like we said, we definitely want to find out more about that blood sugar. Oh, and then, we've got a pop-up here that says you can only select 6, which is really helpful because it did tell us in the beginning you can only pick 6. So now we got to go back and think about it. Well, like I said, the sore throat and the nasal congestion, it was started a week ago. It may have precipitated the situation, but does it need immediate follow-up? So actually, I'm going to unclick that one, and then we'll come back down here, and I definitely want to follow up on that blood glucose. So I'm going to click that one. So I've got 1, 2, 3, 4, 5, 6. And as we've seen, that's as many as I can click. Otherwise, it stops us from going forward. So we've got our 6 options. We're going to hit submit. And then here we have our scoring. So it tells us here, this is UWorld style of showing you your scoring. So it gives you little check marks. So here's a check mark that tells you that, yes, you are correct. You do need to follow up on that pregnancy status. And then same here for the loss of orientation, the vital sign abnormalities, and then absolutely that elevated blood sugar we need to follow up on. There's also this helpful scoring rule pop-up for UWorld that you can click on, and it'll tell you more about how this item is scored in case you forgot. This one is a 0-1 scoring model. So that wraps up this one. Whether you're taking the current NCLEX or the Next Generation NCLEX coming on April 1st, 2023, practicing NGN questions will help you prepare for the exam and bedside practice. Visit nursing.uworld.com for more information and to see our options for RN and PN, and to start practicing today. Thank you.